Hi, I'm Dr. Thaker from Thaker Cosmetic and Wellness here in beautiful Las Vegas, Nevada. And I want to talk to you today about the wellness side of my practice. And a key aspect of that is pain management. And I wanted to start with sharing with you my pain management philosophy. Just because the exact cause of pain has not been determined by prior doctors and treatments the patient has seen, this does not mean that a pain generator does not exist. The patient is still in pain despite the lack of an exact diagnosis. It is not the patient's fault in the 21st century, with all of the modern technologies that we have, that we still cannot always determine pain's exact cause. Let me ask you this. Would someone short of breath be dismissed by physicians simply because they could not determine the cause of the patient's shortness of breath? Of course not. Yet, this is exactly what happens to patients who experience pain without an exact diagnosis every day all across the country. This pain can and must be treated for the patient regardless, and this is the cornerstone of my pain management philosophy. Now, I want to talk to you a little bit about the diagnosis strategies that we use to determine the cause of your pain so we can come up with a treatment plan to get you pain relief. And you'd be surprised, but the most important part of this diagnostic treatment plan, even with thousands of dollars of equipment and my decades of training in surgery, orthopedic surgery, family medicine, and pain management, with all of this training, these techniques, this technology, the most important diagnostic strategy that I have, that I use to help you, is listening. It may surprise some patients and perhaps many doctors, but listening is the key to diagnosis in pain management, more so than any complex technology or even the physical examination. I have 5 surgical years of training, and I have a board certification in pain management by the Board of the American Academy of Procedural Medicine. It's a non-ABMS board that offers training for the office setting for pain management patients. And when I was doing hospital procedures for pain, that was done in the surgical training. So now I bring the best of those different arenas to you in the office setting to diagnose and treat pain. Yet despite all of that, listening is the key. Your evaluation by me will begin with a thorough, unhurried history that you provide, as well as we ask you arrive with your relevant treatment records in hand and the contact information for prior treatment centers, because we want to obtain those details for you. In fact, most of the time in medical practice, a diagnosis comes from the careful history and the further examination, even the physical exam and the sophisticated technology we use, the imaging we use. All of that merely serves to confirm the diagnosis that's established in your history. Thus, simple listening is first and perhaps the most valuable aspect of your pain management treatment plan. So if you're suffering from chronic pain, joint pain, back pain, muscular pain, chronic migraine, I'd like to welcome you to Thaker Cosmetic and Wellness here at 9420 West Sahara Suite 105, 702-545-0660, or you can look us up on the web, thakercosmeticandwellness.com. We'd be happy to talk to you and get you started on a treatment plan that's going to give you some relief. Thanks very much for listening.